Hello. Today let's talk about attachment theory. This in itself again is a question and also forms a very important basis for us to understand a lot of disorders that we see in adults, including personality disorders, and the classification of ICD and DSM also gives attachment disorders specifically. Apart from that, a lot of other child and adolescent disorders can have the basis of impaired attachment or a attachment style which is impaired, right? To keep with that in mind, let's start. So attachment theory points it out that young children have an innate need to form the emotional bonds with caregiver for survival as well, and along with that the psychological development. Their whole basis of defining the attachment theory is this. Now, there are two main names that come to our mind when we talk about attachment theory. The first one is John Bowlby, who developed this theory and emphasized on not only the evolutionary and psychological basis of attachment, he also pointed out the ethological basis of attachment or his own theory. Apart from that, there's Mary Ainsworth, who expanded this theory through her strange situation experiment, which is something that we will be speaking about shortly, and identified various different attachment styles and how each one of them can then influence the development of the child. John Bowlby was a British developmental psychologist and a psychiatrist. He explored the behavioral and psychological consequences of both strong and weak emotional bonds. His major work included working with delinquent children, and in 1946, when he joined the Taviots Institute of London, that is where he developed the attachment theory of what we know right now. In his ethological theory, he has also recognized the infant's emotional tie to the caregiver as not only the basis of forming an attachment, but also the fact that that is what actually promotes the survival of the child in both emotional and psychological way. He also induced this idea where he emphasized about the infant caregiver bond, right? And along with that, he continued to retain the idea of the psychoanalyst that the quality of attachment continues to be very important to form stable relationship. He in fact re-emphasized on the fact that feeding is not the basis of attachment, right? And there are other factors that come into the play when the attachment is concerned. Now, the central home, what we talk about attachment theory, is that the primary caregivers who are available and responsive, right? So, it's not just the availability which is important, it is the availability and responsivity to the infant's need ends up giving the child a sense of security and forming stable relationships, right? So the 2 points that he stressed upon in this was not just the availability but also the responsivity of the caregiver. These two things are very much required for them to actually have a stable relationship. Now, that being said, let's talk about the components of attachment that have been described. These are the four major components of attachment that has been described. A easy way to remember it would be with examples. So, we will be giving examples as we go ahead. Safe haven is basically implying that the child can rely on the caregiver to comfort him or her whenever the child feels that he or she is in danger. So, a small example here would be that just imagine a child is given a toy which he doesn't like. He gets scared of that toy, starts to cry, and looks for his mother. The mother comes, removes that toy, hugs the child, and the child stops crying. Now, here it's a small act, but here the mother has ensured that the child is given a safe environment, and the message that has gone to the child here is that if things are scary or if things are not in the control, then my mother or my primary caregiver will take care of things and my safety will be ensured. Now, following that, the second point is the securing the base. Okay, so securing the base. Now imagine a child who's asking questions to his mother about why my father has gotten sick, or why is he not here, or why can't I play at the moment. And at that point of time, the mother answers those doubts not only reliably, properly, and caters to the doubts that they have. Now, here the caregiver gives a good and reliable foundation to the child as he goes on to learning and sorting his own thing, right? So, this example was about learning, right? It could also be about sorting, where he has gone out and come back and asked questions to the mother or the father, and they have actually discussed with the child properly. So now he is learning and sorting things out on his own, but there is still a base which is secure, to which he can come back and ask things and go ahead and continue to have an own autonomy as well, right? The third point is that of the proximity maintenance. Proximity maintenance means not just the physical proximity maintenance, like how we spoke about the responsiveness there. It is also the uh, just the emotional proximity maintenance as well. So, for example, a teenager discussing about the peer problems with the mother, that is also an indication of proximity maintenance, right? So, here the child aims to explore the world, but still wants to stay close to the parents, right? Or the caregiver. And at that point of time, it is important that that is ensured. Lastly, separation distress. So, separation distress is that the child becomes unhappy or sorrowful when he becomes separated from the caregiver, right? So, when the infant is taken away from the mother, he begins to cry. So, these are the four main component of attachment that is present, right? So, again, I will like to repeat in just single line: safe haven, secure base, proximity maintenance, and separation distress. So, you can remember it by a child playing in the park. Okay, so this is a child who's playing in the park, and this is the mother. This is the child, and this is the mother. Okay, and the safe haven means that he got a toy here but got scared, went back to the mother who took away the toy and hugged. Okay, so the haven was safe. Secure base means he went out and he had a lot of questions, so he came back, asked, and he got a good and reliable foundation while he's figuring out his learning abilities. Proximity maintenance, he comes back and asks other sort of questions which is emotional in nature. And separation distress is when this child was young and he was taken away, he used to cry, right? So we can try to remember it by just this one example. This is what is called as the circle of security. Circle of security includes the components that we have spoken about. Apart from that, if you can look, it also includes the other part as well. So here is a secure base, right? The safe haven where the child is asking, protect me, comfort me, delight in me, organize my feeling, right? And here the child is trying to explore but wants to come back as well. So secure base is given at that point of time. Watch over me, right? I need you to. So all of this comes a part of the circle of security. Now we will be speaking briefly about 4 phases of attachment development. Here, according to the Bowlby, the first 3 years are the most sensitive part of the attachment. According to Bowlby, following are the 4 phases of attachment that are given. Number 1 is the pre-attachment phase. We have that from birth to 6 weeks. Then it's easier to remember the 6 things. So birth to 6 weeks, 6 weeks to 6 months, 6 months to 2 years, and then basically 2 years and onwards. Okay, so here there is a pre-attachment phase, indiscriminate phase, discriminate attachment phase, and multiple attachment phase. Let's talk briefly about the understanding about each of these phases. It's just for knowledge sake, and it will help us to understand why the attachment becomes important. So in the pre-attachment phase, you can understand that the child is quite young. It's from birth to 6 weeks. There are infant signals such as crying or fussing, which will naturally attract the mother, right? So the mother or the caregiver will come and soothe the baby at that point. Now baby will become happy, or he'll stop crying. This positive response will then encourage the mother or the caregiver to remain close. So these are innate signals which are attracting the caregiver to maintain this kind of attachment. Now, when the baby responds in a positive manner, the caregiver stays by, right? And the infant also gets encouraged by the adult who's staying by as it comforts them, right? So they are not yet attached to the mother and they don't mind that the mother will leave or any unfamiliar adults, as they have no fear of strangers here, right? However, they like the fact that a caregiver is taking care of them. Now, in the indiscriminate phase, which is from 6 weeks to 6 months, the infants start to show preference for primary and secondary caregiver. They develop the trust that the caregiver that they have will respond to their needs while they still accept care from others, right? They would still prefer the caregiver to take care of them. They have started to develop a sense of trust here, right? Where they expect the response of the caregiver when signaled. They do not protest when they get separated from the caregiver, but like it more positively when the primary caregiver is around. Discriminate attachment phase, which is from 6 months to 2 years, infants show a strong attachment and preference for one specific individual. They will protest when separated from that primary attachment figure, and this attachment is to the familiar becomes very evident to everyone. They have now developed what we know as separation anxiety, right? So here is where they have developed separation anxiety. Here there was just sense of trust. Now here they have developed separation anxiety. This anxiety will increase between 6 to 18 months and its occurrence depends on the temperament and the context of the infant and the behavior of the adult, right? Okay. So now the child who shows signs of distress in case the mother leaves, but with the supportive and sensitive nature of the caretaker, the anxiety should come down as well. Lastly, we have the stage of multiple attachment phase from 18 months to 2 years. Now they have strong emotional bonds with other caregivers as well, right? Here they have multiple caregivers with whom they have good enough attachment bonds. This often includes now the father, older sibling, grandparents, and a lot of them. This rapid growth in representation and language by 2 years also helps with understanding of this, and they are also able to show the same. The child depends less and less on the caregiver progressively here onwards. So the major strength that we have of the attachment theory which was given was that there is a dominant explanation as to why the attachment develops and how is it developing, and we get some idea about the same. Bowlby also has suggested that the attachment evolved as an aid to survival, right? In case it is true, then attachment and care-giving behavior must be universal in all cultures, irrespective of the differences in the practice of child rearing, which is true in most of the cases. The weakness is that evolutionary ideas are very difficult to be tested or proven, right? And the other problem is that all of these attachment theory generally tend to focus only on the mother's role, whereas it's evident in two-parent families that that's not the case, right? Or even in bigger families that that's not the case that ends up happening. We will now be speaking about the other thing that Bowlby had done, which was the internal working model proposed by John Bowlby. It refers to the mental representation or schemas that the individual developed based on their early attachment experiences with caregivers. These models guide the perception, emotion, and behavior in relationships throughout life, not just regarding in the childhood. There are three major components of internal working model. The cognitive component, how are they thinking? The emotional component, how are they feeling? And the behavioral component as to how are they interacting. The cognitive component includes beliefs about self and beliefs about other. Am I lovable? Are they trustworthy? Questions like that. Emotional component include that feeling of security or anxiety in a relationship, right? How do they feel when they get in a relationship? Behavioral component includes patterns of interacting with others based on past experiences, such as some of them will avoid intimacy, some of them will seek excessive closeness. So things like that are basically a part of the internal working model in which the mental representation of schemas are based on their attachment experiences with their caregivers is now stored, and that will determine the relationship and how the bonds will be formed later. Now we come to Mary Ainsworth. Mary Ainsworth was a Canadian developmental psychologist who conducted research in the field of attachment theory. She also briefly worked with John Bowlby during the time of the attachment theory development and developed her own strange situation test, which we should be talking about. Coming to the strange situation test, it's an interesting test because it revealed the profound effect of attachment on the behavior. Now, in this study, the children who were observed were between the age of 12 to 18 months, and as they responded to a situation in which they were briefly left alone and then reunited with their mother. The point of this test was to see the responses and to have the kind of attachment and know what kind of attachment ends up happening, or do we see a pattern in that? Ainsworth described three major styles of attachment based on this test: secure attachment, ambivalent insecure attachment, avoidant insecure attachment, right? And the later on, Main and Solomon added a fourth attachment style called as disorganized insecure attachment based on their own independent research. Let us talk briefly about the strange situation overview. Now imagine that the mother and the child and the researcher are sitting in the room, right? Here initially what will happen, the researcher will introduce the mother and the child to the room, right? So that the child is comfortable and give the instruction and leave. Now it's the mother and the child in the room for the next 3 minutes. Mother sits, plays with the child, and mother can respond if the child initiates any sort of interaction. Now, after this, in the third step, the stranger enters. The stranger enters the room, sits quietly for a minute, talks to the mother for another minute, and engages with the child for another minute. Right? At this point, the mother, child, and stranger are there in the room. Now, the fourth thing that happens is the mother gets up and leaves. Stranger responds to the child as needed, which is he picks up the crying child, interacts minimally to calm the child down, right? And if this continues for the next 3 minutes. Now the mother returns, greets the child as she normally would, and the mother resumes minimal interaction when possible. Okay? After the child is less distressed, the mother resumes the interaction. Again, after this, the mother again leaves and the child is now left alone in the room, right? If the child is not distressed, it goes on for 3 full minutes. After this, the stranger returns to the room, right? And responds to the child as needed, picks up the crying child, interacts a little bit. Okay. So again, there is child and stranger in the room. After in the last step, the stranger leaves, mother returns, greets the child and responds as she normally would, right? So this is the sequence that in which the strange situation preview was done. Now the behaviors which were noted were the amount of exploration the child was doing, okay? The child's reaction to the departure of the mother, the stranger anxiety when the baby is left alone with the stranger, and the child's reunion with the mother with the caregiver. Right? So these were the few behaviors that were noted. Apart from that, there were 4 interaction behaviors that were exclusively noted in the 2 reunion episodes. Number 1, proximity and contact seeking. Did the child actually come back to the mother and how was it? Contact maintaining. Did he maintain the contact? Avoidance of this proximity and contact. And lastly, resistance to any other contact and comforting. And lastly, any other behavior which was noted. So it was Ainsworth identified type B as secure, type A as insecure avoidant, type C as insecure ambivalent resistant. She concluded that these attachment styles were the result of early interaction with the mother. And as we have mentioned, the fourth got added on later. This was how most of them reacted. We can see by this table that most of them were falling under the secure blanket. Right? Now, strange situation behavior that was noted was that Here, in the secure one, acknowledged the parents' return upon reunion and after a while went back to playing after suit and may or may not cry during the separation but gets distressed after a while and becomes okay. Assumed behavior here is that the child is feeling confident in parents' availability due to the history of sensitive care. We go now to the next one, which is insecure avoidant. In this, 15% are there. Here, they fail to acknowledge the parents' return. As easier to remember would be that avoidant is here, and here they are failing to acknowledge the parents' return, right? And they continue to play or they turn away. They're also less likely to cry during the separation. What does this tell us? It tells us that they are not confident in the parents' availability due to history of unresponsive or rejecting care. Then we have organized insecure resistant, where mixture of seeking and reseeking contact is there, right? So we know that ambivalent or resistant is the same thing. So here you can learn this as ambivalent. It will help us to easily remember. Ambivalent means there will be a mixture. So here will be a mixture of seeking and resisting contact and angry quality even when they meet, right? They are highly distressed and they are very difficult to soothe. Why is so? Because they are not confident, because there is no consistency in the care. They are not sure. The child is not sure because of lack of consistency in the care as to about the parents' availability. Lastly, we have the disorganized, which is 15%. Here, there will be odd or anomalous behavior. So, for example, will be contradictory behavior such as crying while turning away, or there is no organization that is noted at that point of time. So, they are dysregulated in the presence or without the presence also. So, it does not show any particular care that is being done. Sometimes it may also be there that there is history of frightening or an response when the caregiver walks in. Limitations to this theory is that attachment theory is a theory of development and not pathology. So, even though we know that a lot of its implication can be applied to disorders now, but it is still not a theory for pathology. The parental sensitivity seems to be playing a major role here in attachment, but we know as a fact that that's not the only condition which affects a child frame relationships. Differences in attachment could result from diverse infant temperament as well, which is not taken into account, and most of the time it's just the parenting which is being focused here. It is limited to the primary caregiver here as well, which is the mother. Lastly, we have the relevance to the psychiatry to this is that it can be seen the poor attachment style or disorganized or any other sort of insecure attachment style can be seen in borderline personality disorder, sometimes even antisocial personality disorder, mood disorder, anxiety disorders, attachment disorders of both the kind, reactive or disinhibited, right? And we also can use the model of transference to actually help with this attachment problems, and there are various therapy models which are based on the attachment style specifically. That brings us to the end of this topic of attachment styles. Thank you.